Senator Rausch, it was quite a week here in Massachusetts. Hopefully, we are days away from phase two. But the big news this week, of course, the rallies, the marches, and unfortunately, the vandalism and looting in Boston and other communities throughout the Commonwealth. Your thoughts?
Oh, Peter, I have more thoughts than could fit into this interview. But really, my thoughts are not the thoughts that I think are the most important. I think the most important thing that I can do as an ally, and an ally who is here in all senses of the word, here to do the work, here to listen, here to lift up the voices that have been marginalized and silenced for far too long. The best thing I can do is amplify their voices. What happened to George Floyd, Breonna Taylor, Tony McDade, and countless more Black people in encounters with law enforcement in America is unequivocally wrong. And we should be unequivocal in our pursuit of justice and structural reform. I will always stand in solidarity with Black folks in this Commonwealth and in this nation, a nation built by slavery on the backs of people of color, and a nation that is forever shaped by the legacy of slavery. And I embrace my responsibility as a state senator to continue supporting and advancing the work of racial justice and equity in the legislature. And I also pledge to do it better. Better by listening more, better by doing more critical self-examination, better by encouraging my fellow white people, and particularly white legislators, to use our privilege as a force for good and examine our unearned privilege, however uncomfortable that work might be. Better by building upon the incredible momentum created and sustained by the Black Lives Matter movement and countless civil rights leaders here in our Commonwealth and nationwide, and in fact, globally. And better by advancing legislation that protects our Black community members and gives them the support they deserve to live happy, healthy, safe, and successful lives. I must say that I have been very proud. I have always been proud to represent this district in the state Senate, but I have been particularly proud over the last week with protests and rallies and vigils springing up all throughout the district, in every corner, every pocket. I personally have attended events in Natick, Wellesley, Franklin, Needham, and tonight I'm heading to Norfolk. There was also a demonstration in Wayland. And I ask anyone who is listening to this, anyone and everyone, if you are planning an event or know of an event supporting the Black Lives Matter movement in our district, please give me the details, send me an invitation. I would love to join you. So far, we have received, just this week, we have received almost 100 messages from constituents all throughout the district, including a significant number of them from North Attleboro, specifically asking questions, the answers to which will advance racial equity, questions that will enable a broader awareness and awakening, and a level of activism, frankly, that I haven't seen before, and I am very, very proud and privileged and honored to see.
The demonstrations, the march, the rally at Franklin Park, the gatherings in front of the State House have been peaceful, but as they break up, another group seems to use that to their advantage. I mean, in nearby Rentham this week, a caravan was headed apparently to do damage and loot the village outlets in Rentham. How can the police, and I guess if you know the answer to this one, you're probably one of the wisest people on the planet right now, but how can police allow people to exercise their right to assemble, to protest, but at the same time, not create situations, and not that the police are creating the situations, but we've seen in Brockton the other night, lawlessness, uh, downtown crossing in Boston on Sunday night. At some point, doesn't some action need to be taken?
You know, Peter, I have worked with every single police chief in this district, and and the I I am very proud, especially of the police chiefs who have specifically spoken of condemning what happened in Minneapolis, saying that we will not tolerate the racism and injustice and inequity, that we have already done training and we do training consistently on unconscious bias and implicit bias, and we will continue to do that work and more. And frankly, it gives me hope. I do not envy the police chiefs having to figure out how to thread this needle. It is very difficult, but I think the first thing on the list should be listening. Listening carefully, listening to devise strategies, you know, and on Tuesday this week, just a couple of days ago, the entirety of the Black and Latino Legislative Caucus and elected leaders of color from every level of government, federal, state, and local, walked from the African Meeting House on Beacon Hill to the State House, and then gave a press conference on the State House steps. I was deeply, deeply honored to be invited to walk with them, in support of them, in solidarity with them, behind them, and stand there as they deliver their 10-point plan to begin the work of breaking down barriers to equity, breaking down structural racism. This isn't something we're going to solve overnight. It's been building for 400 years. You know, it is a nation built on the back of structural racism. And this is going to take, and it has always required, significant, dedicated listening, work, and the centering of marginalized, previously marginalized voices, and hopefully not marginalized again in the future. And it will be uncomfortable. And we will make mistakes, all of us, and we will have to own those mistakes and live with that discomfort, and then move forward. And that 10-point plan is again just the beginning. But one of the points that was made by, I believe it was Mayor Dan Rivera from Lawrence, who said, just put the word de-escalation. Is the word de-escalation in your use of force policy? How many times is the word de-escalation in that use of force policy? Put it in there. It doesn't cost $1, he said. Put the word de-escalation and put it in at every step of the way, every stage of an interaction, every step. If it feels like it's escalating, try to de-escalate. If it goes up again, try to de-escalate. And you know, the first thing he did was he came up to the podium and he took his wallet out and he took his keys out and he put it on the top of the podium. And somebody, you know, went to go help him and because they thought that he was just sort of uncomfortable with his keys, but that wasn't it. You know, he took those things out and he looked out at the audience and he said, that's what I do when I get pulled over. That's what every Black man in America probably is doing when they get pulled over by the cops. And I put my hands at, you know, clearly on the steering wheel. Now, as a white person, I've never done that. And I have never even thought about it. So I understand that I will never understand. But we all have to do this work. We all have to do it together. And I look forward to listening more. In fact, I had a tremendous opportunity to do some listening just the very next day. I co-hosted a COVID-19 maternal health equity town hall. I co-hosted it with Congresswoman Ayanna Pressley and Senator Elizabeth Warren, State Representative Liz Miranda, and State Representative Kay Khan, along with this newly formed coalition on perinatal health in the era of COVID-19, and listening to women of color, particularly Black women, speak openly, honestly, and authentically about their experiences in childbirth and in pregnancy generated so many ideas that I quickly contacted my staff member who was on the town hall with me and said, get all this down, because there are tremendous ideas coming from this raw and appropriately raw and authentic set of stories that we are hearing from these birthing people, and we need to act on them, right? That is a way that I can be part of the solution here and stand in meaningful solidarity with folks of color all throughout the Commonwealth. And I invite those ideas to come from anyone and everyone. We have a lot of work to do, and law enforcement is part of that work.
You mentioned COVID-19, the impact on maternal health. So much has been made, and rightfully so, of the lives lost in nursing homes. I've read a heck of a lot about how it's impacted women who are pregnant and giving birth. Fill us in on that.
Well, the impact has been different in a variety of different circumstances and in different states. In New York, I think, I would have to check, but at least one other state, people giving birth were not allowed to have any member of their support team in the room with them, right? And in general, giving birth is scary. Giving birth is very exciting, but giving birth is very scary, and particularly, I have a bill that has advanced favorably out of its initial committee and is now sitting with the Senate Committee on Rules, specifically addressing racial disparities in maternal health. But we live in a nation where Black women die in childbirth at a rate of roughly 4 times as much as white women, just by going to the hospital to have your baby, right? And that is significant, to put it lightly. So we are also seeing a significant, and that's to say nothing of the sort of added layer of fear of going to a hospital right now, right? I mean, hospitals are appropriately the place where people who are having serious effects from COVID-19 go, right? Makes perfect sense. But to go when you don't have COVID-19, and particularly when you are bringing a new person into the world who has not had a chance to develop their immune system yet, and is more susceptible to illness for a whole host of reasons, is nerve-wracking. I can only imagine. So we've also seen a pretty significant uptick in requests for home birth care. But Massachusetts is one of just a handful of states left in the nation that does not license and formally certify professional midwives. These are the midwives who are trained to provide home birth care for birthing people. And in fact, the data shows us that home midwifery care particularly advances and supports maternal health for Black women and other women of color. And that is a really important additional piece of legislation that we can do. That bill has been filed for a while. It already has advanced out of the Public Health Committee. It's now in healthcare financing. I am the lead sponsor in the Senate on that bill. But these are just a couple of the stories that we've heard from women who are giving birth or about to give birth or just gave birth. They don't call while they're in labor. That's not actually what they're doing. More important things to do in that moment. But these are the real stories, real lived experiences of people in our Commonwealth, and we need to do everything we can to lift them up and to advance equity and generate justice and fairness for everyone. And so it's unfortunate, to say the least, that it took the gruesome death of George Floyd to generate this level of awareness. But now we're here, so let's get a move on.
One other issue you are working on, the Community Immunity Act. Talk about that.
So the Community Immunity Act, I think we've talked about this before, is a comprehensive infectious disease prevention bill that I filed. I started working on it pretty much the moment I walked into the office. In fact, even before I got sworn into the Senate. But really started working on that very early in my term. We filed it back in September, and just within the last week, it was reported favorably out of the Public Health Committee. I certainly didn't envision a pandemic when I wrote that bill, but COVID-19 has forcefully demonstrated just how important it is for us to have comprehensive state level infectious disease prevention policy. And we really don't have that right now. So the bill does a whole slew of things to standardize, centralize our immunization policies, our exemption processes, also provide better data collection. Right now, we don't even have mandatory data reporting on immunity rates throughout the Commonwealth. We have a voluntary survey, so we make that mandatory as well, and also provide education and outreach and notification to people all throughout the Commonwealth, and even to the current moment, right? We don't have a vaccine to COVID-19, though folks all over the place are sort of waiting with bated breath for one to come out. We're going to be waiting, I think, quite a while, at least another year for that to happen, maybe 18 months or longer. But even in the absence of a vaccine, the policies that are at the base of the Community Immunity Act would have helped, even in this moment, to disseminate information and provide resources for people all throughout the state. So it's a very broad approach to public health infrastructure. And so I'm very proud of the work that my team and working with Leader Donato in the House that we've all been doing up to this point. We now have I'm just tremendously proud that we have a favorable report on such a comprehensive, groundbreaking, life-saving bill in the first session that it's been filed. So we got a favorable report out of Public Health. It is now with clerks, and then and we will see what the next steps are. But it's really important, perhaps now, certainly more now than it was when I filed, and perhaps now more than ever before.
And then lastly, is it 722-1555 or something like that?
Well done, Peter. Yes, it is 722. It's as if you've been hearing me say this every week for the last 3 months. Yes, of course, reach out to my office, 617-722-1555. You can email me directly, becca.rausch@misenate.gov. The website is beccarauschma.com. Sign up. We've been doing our virtual office hours on alternating Fridays since back in March. So we are here. We will always be here to support folks with particular issues, small business questions. We've been helping a lot of small businesses actually try to, particularly in the fitness arena, trying to sort of strategize about the reopening and questions about budgeting and what the state budget is going to look like. Not good. Big deficits, estimates. So yeah, we're here. Reach out, and you can follow us on social media for Facebook and Twitter for some real-time updates as things progress. They do change in a moment's notice these days.
Yes, sir. Senator, thank you. Have a wonderful week.
You too. Thanks so much, Peter.